Good evening, Mr. Bear. My name's Peter. I'm going to be your student nurse today. I'm going to go ahead and perform hand hygiene and don on some gloves. Can you tell me your full name and date of birth and MNR number? Your teddy bear, 12/25/1990. MNR number is 12345. Same as your wristband and same noted on your chart as well. Do you have any allergies, Mr. Bear? No, you don't have any allergies? Okay. Any allergies to any medication? No. Any tape or latex? No. Any environmental factors? No. Any food allergies I should know of? No. All right. No allergies mentioned. No allergies mentioned on the wristband, and no allergies on the chart. All consistent. All right, Mr. Bear. I'm going to go ahead and cover your vital signs. Your blood pressure is 120/80. Your heart rate is currently 80. Your respiratory rate is 17. Your pulse oxygen saturation is going to be 98%, and your temperature is 98.6 degrees, all within normal range of findings. Are you currently experiencing any pain, Mr. Bear? You are experiencing pain. I'm sorry to hear that. When did the pain first start? A week ago? Where is the pain? In your left knee? How long you've had the pain? How long does it last? Is it constant, or is it off and on throughout this past week? It's been a constant pain throughout the whole week, okay? And then can you describe the pain for me? Has it been a acute sharp pain, or has it been more of a throbbing dull pain? It's been a throbbing dull pain, all right? And then in terms of what aggravates the pain, what makes the pain feel worse? The pain feels worse when you're climbing stairs or going for a walk. What makes the pain feel better, Mr. Bear? The pain feels better when you have your leg up and elevated on a couch watching TV, okay? And then have you done any form of treatment on your knee, Mr. Bear? You've taken medication? What medication you've taken? You've taken some Tylenol, okay? And note that and document that in your chart that you've been taking some Tylenol. Has that Tylenol helped you? Yes, it has a little bit, okay. And then finally, following up, what's the severity of the pain on a scale of 0 being no pain at all, 10 being the worst pain you ever felt in your life? What is today's pain level, Mr. Bear? How severe the pain is? 5 out of 10. All right. I'm sorry to hear that you have a 5 out of 10 pain level. We'll go ahead and assess you and see if we can do anything about that pain level for you today, Mr. Bear. You know where you are, Mr. Bear? Yes, you're in the hospital. Okay. And then what's today? Roughly what time is it? Well, it's Thursday evening, and you're absolutely correct, Mr. Bear. So the patient is alert and oriented ×3, the person, place, and time. The patient has no sign of physical distress. The patient is symmetrical as well. All right, so we're going to follow up with equipment assessment, Mr. Bear. Check your nasal cannula. Check for any skin breakdown, rashes or lesions, and make sure there's no kinks in the tubing. Check around behind you, both the sets of your ears. Check to make sure there's no skin breakdown, rashes, or lesions. Following that tubing to your flow meter, and then making sure it's the same flow rate as the provider has prescribed within your chart, and as well for yourself with your condition. And then if you had IV placement, making sure I would check the palpitate around the IV placement. See if there's any tenderness, edema, or erythema with the IV placement, and following the IV line, following all the way up to the bag, making sure there's no kinks in the line. There is appropriate, also noting that make sure the IV is actually the right medication according to provider's orders, and it is the right dosage as well for the patient. And the patient, Mr. Bear, does not have a urinary catheter. However, if you did have a urinary catheter, make sure the tubing is connected to the catheter, as well as the tubing is nice and secure to the patient's leg. There is no skin breakdown, rashes, or lesions, and it is dry. Following the tubing, there's no blockages and kinks in the tubing, all the way to an immobile portion of the bag where the bag's hanging, and checking for, I would document the amount of urine and urine output coming out within the bag, and the consistency of the urine within the bag as well. For Mr. Bear, if you would tilt your head down, we're going to do a hair, skin, and nails assessment. Head down. And then we're going to go ahead and part your hair. Upon looking at your hair, Mr. Bear, it's nice and even. There's no skin breakdown, rashes, lesions, or with your scalp. And so your scalp is not dry, and you're not experiencing dandruff. Next, we're going to go ahead. Do you have any wounds, Mr. Bear? No, you currently don't have any wounds that I should know about? Okay. If you did have wounds, I would make sure I would assess the dressing, as well as any drainage, noting any drainage chart, and also checking the drains that are attached to the wounds as well if you have a drain. All right, and then so we're gonna go ahead and check for skin tear. Check for skin tear on each extremity. Nice rebound. Have nice rebound on all, when I skin tear, rebound on all extremities, which means you're overall well hydrated as a patient, which is fantastic. And then we're going to go ahead, look back of my hand, assess your skin. Skin is warm and dry overall. And your skin tone is matching your ethnicity, so no signs of any disease, skin signs from skin that you have any diseases present as well. I'm going to check your nails now. I'm going to go ahead and press down on each nail bed from 1 inch wig. And your cavity refill is less than 3 seconds in all extremities. You're bitter. You do not have brittle nails at all. They're not brittle, so overall healthy nails overall. Now, next I'm going to go ahead and inspect, do your HENT. Go check, inspect your ears, your external ears. And I'm going to go ahead and get up, inspect this ear, and palpitate for any skin breakdown, lashes, or lesions, which you currently don't have. No signs of any drainage within your ears right now, or any blockages that I've seen at all. And then I'm going to bring my hand up right to the front of your face, and we're going to inspect. I'm going to use my light here. I'm going to flash you a couple times on each eye, check your pupil dilation and pupil assessment. Okay, go ahead and do that. All right, Mr. Barry, if you follow my pen light in and out, in, out, in, out, okay, and then you follow it out. Whisker effect, your pupils. All right, Mr. Barry, your pupils are equal, round, reactive to the light, and combination for that patient. I'm going to go ahead and, can you tilt your head back, Mr. Barry? Yes. And I'm just going to use my hands to open up your eyes a little bit. Your conjunctiva is pink and moist, your sclera is white. And then we're going to go ahead and assess your nares, your nose. Your septum is midline, and nice and pink in nares. There's no signs of any drainage at all, or sores or lesions within your nasal cavity. Can you say ah for me, Mr. Bear? I'm going to check your mouth. Ah. All right, so your oral mucosa, Mr. Bear, is pink and moist. Your tongue is doesn't have any cracks in it, and it's pink and moist as well. And there's no sores or lesions within your mouth. And your uvula is midline as well, which is a fantastic finding. And then, can you give me a nice big smile, Mr. Bear? Smile. All right. Your facial symmetry is nice and even with your facial muscles. All right, Mr. Bear, next is going to be our respiratory assessment. Upon looking at you right now, you're not using any accessory muscles for, and breathing is nice and even, not latent. You're not experiencing labor breathing that I know of. Are you experiencing problems breathing? No, you're not experiencing problems breathing, Mr. Bear. Okay. Can you turn around, Mr. Bear? Yes, you can. Okay. All right, Mr. Bear, turn around for me. Now I'm going to use my stethoscope. When I press, use my diaphragm, my stethoscope on your back of your skin, if you will, using Greek, and of course I'm going to be also using the Greek key pattern across your back. But every time I press on your back, can you please inhale and exhale? All right, Mr. Bear, you can go ahead and turn yourself around. All right, Mr. Bear, overall your lungs were clear and consistent in all lobes, and so I didn't hear any fluid build up in your lungs at all, and I didn't notice any difficulties in your breathing upon auscultation. So perfect. Now next is your cardiac assessment. So I'm going to go ahead and assess your carotid arteries first with palpitation. One at a time. My fingers. Okay. All right. There is, upon palpitation, there's no thrills present, and your rate and rhythm are equal and bilateral. And you're going to assess your radial pulse and your dorsal pedal pulse. All right. Your radial pulse equal rate and rhythm, and the same with your dorsal pedal pulse is equal rate and rhythm overall for your assessment. Now, next I'm going to use the stethoscope here. I'm going to go ahead and use the bell function of my stethoscope on your carotid arteries. That's individually at one time. That's for any swishing sounds. I'm going to go bruise. And hold your breath. All right, no bruities present, no swishing sounds present. And then we're going to go ahead and assess your heart valves. And to do this, make sure you hold your breath using the stethoscope. And then so I can get the best, I hear the best with all those valves. So, and I'm going to tell you the placement where I'm going to be doing it. So I'm going to be inspecting your aortic valve located in your right sternum border, second intercostal space, and then proceeding to your pulmonic valve located in your second intercostal space, left sternum border, and proceeding to Erb's point, and the third intercostal space, left sternum border, and then following up with the tricuspid valve located in the fourth intercostal space, left sternum border, and then proceeding down to the mitral valve located in the fifth intercostal space, mid-click or vine. Now, before I did that, for a rigor assessment, I would assess the PMI as well, check for any lifts or heaves, which were none noted for this assessment. So, and for inspecting your valves, I would assess both using the bell and diaphragm. And I'm going to use the bell first for this assessment. Aortic, walk, Hirsch point, mitral. Hold your breath. All right, Mr. Bear. So upon listening to your heart sounds, I heard S1 and S2 heart sounds, no heart murmurs present, no S3 or S4 sounds, pulses, rate and rhythm throughout your entire heart. And overall, next we're going to be assessing your GI. Your overall GI function. Are you currently experiencing nausea, vomiting, or diarrhea? No, you're not currently experiencing any of that. All right. Do you have any dietary restrictions I should know about, Mr. Bear? No, you don't have any dietary restrictions. All right. And then for within, when was your last bowel movement? The last bowel movement was an hour ago. Okay. Was it abnormal or normal, Mr. Bear? It was a normal bowel movement. Okay. Awesome. All right, Mr. Bear, I'm going to have you go ahead and lay down for me. Thank you, Mr. Bear. I'm going to check your overall symmetry. And also from your feet. And you have a 1 to 2 symmetry. Your symmetry overall is nice and even. for your abdomen. You're experiencing any tenderness, Mr. Bear, in the abdomen? No, you're not? Okay. I'm going to palpitate with one hand first and then proceed with two hands, but for this assessment, I'm not going to stand up. I would stand up from my left. And starting with the right lower. Okay. And right upper, left upper, left lower. And then any tenderness, Mr. Bear? No. A little harder. Right. And the left side. All right. So upon palpitation, there's no masses or any abnormalities, and the patient doesn't experience any tenderness or pain throughout palpitation. And we're going to go ahead and check your bowel movements, Mr. Bear. Use my diaphragm in all four quadrants. Right upper, right lower, right upper. All right, Mr. Bear, I heard bowel movements in all four quadrants. If I didn't hear a bowel movement in any of the quadrants, make sure that I have listened at least 5 minutes in each quadrant to make sure I heard a bowel movement. And I'm going to go ahead and listen to your aorta within your abdomen using a bell. See if there's any bruise present, which is right above your umbilical. I didn't hear any swishing or bruise present, Mr. Bear, so feel free to get on up. You can go ahead and sit on up. Thank you. And then next, talk about your urinary function, Mr. Bear. You tend to urinate frequently or non-frequently, or have you been urinating more or less lately? No, it's been normal. Okay. Upon urination, how many times a day do you urinate? 6 to 8 times a day. Okay. And then with urination, is it normal, abnormal, normal for you? And the cutter and normal and cutter and consistency, and it tends to be clear and consistent. Okay. So there's no abnormal functions in your urinary. No. All right. And then for nothing you knows that would concern you. No, not at all. All right, sounds good. Next, we're going to assess your extremities overall, Mr. Bear. And we're going to go ahead and assess your extremities. And a grip test. Okay. And pull me, Mr. Bear. Push me, Mr. Bear. All right. Your upper extremities are rated at 5 out of 5 in strength bilaterally, and then equal strength bilaterally. Then go ahead and step on the gas for me, Mr. Bear. All right, step on the gas for me, Mr. Bear. And go ahead and press your toes up to the sky as hard as you can. Toes up to the sky as hard as you can. All right, and your lower extremities are rated 5 out of 5 on equal in strength bilaterally. Are you experiencing any tenderness or pain, Mr. Bear, throughout your extremities? No tenderness or pain at all. Okay. That's good to know. The only tendon pain you've been experiencing in your extremity was your knee, right? Yeah, that was in your extremity. Okay. Correct. So, all right, Mr. Bear, do you have any questions at all? Yes, you do. About respiratory. The incentive spirometer. So the incentive spirometer teach you, make sure you know how to use that to demonstrate that to you, and also make sure you demonstrate that to me that you learn how to use it to measure your overall lung functions. That's what I would do. However, you currently have your lungs are clear and consistent overall. Any other more questions, Mr. Bear? No. Do you know how to use your call light? Yes, you do know how to use your call light. Okay. So you can go ahead and press that to get me. Make sure that call light's within reach. Do you want to lay back down, Mr. Bear, since it's evening? So you can go to sleep? Yes, you do. Okay. Go ahead. Lay you on down. All right, Mr. Bear. Grab a stethoscope and sanitizer. All right, Mr. Bear. Make sure your call light is within reach. Lower the bed for you for your overall safety. Rise the bed, 2 of the bed rails. You want another rail up? Yes, Mr. Bear. Okay, you can put up the 3rd rail, but I'm not going to put up the 4th, just so you're able to get back out of bed and not restrained. All right, Mr. Bear, have a good evening. I'm going to go ahead and do some hand sanitizer, and let me know if you have any questions, okay? If you need anything else, feel free to give me a call on the call.